Cellulitis. It's an dermatological disease. Look at this picture, shows that infections in the skin, detail going on. Introduction. Cellulitis is a common and potentially serious bacterial skin infection. It affects the deeper layers of the skin and the subcutaneous tissues, leading to inflammation, redness, and swelling. Prompt recognition and treatment are crucial to prevent complications. Definition. Cellulitis is defined as an acute spreading bacterial infection of the dermis and subcutaneous tissue, characterized by localized redness, swelling, heat, and pain. Types. 1. Non-purulent cellulitis. No abscess or pus formation, commonly caused by streptococci. 2. Purulent cellulitis associated with abscesses or pus, often caused by Staphylococcus aureus, including MRSA, methicillin-resistant Staphylococcus aureus. Causes. 1. Bacteria, primarily Streptococcus pyogenes and Staphylococcus aureus. 2. Injury, cut, wounds, insect bites can provide entry points for bacteria. 3. Surgical incisions, postoperative infections. 4. Underlying skin conditions, enzyme, athletics, foot, or ulcers. Risk factors. 1. Skin injuries, cut, abrasions, or burns. 2. Weakened immune system, conditions like diabetes, HIV/AIDS, or chemotherapy. 3. Chronic skin conditions, eczema or arthritis, foot. 4. Lymphedema, swelling to lymphatic system issues. Complications. 1. Abscess formation, collection of pus under the skin. 2. Sepsis, systemic infections that can be life-threatening. 3. Lymphanginitis, inflammation of the lymphatic channels. 4. Necrotizing fasciitis, rare but severe tissue destruction. Pathophysiology. Bacteria enter the skin through the branch in the skin barrier, leading to an inflammatory response. The body's immunoresponse causes increased blood flow and immune cell recruitment to the site, resulting in the characteristic symptoms of cellulitis. Signs and symptoms. 1. Redness, often with indistinct edges. 2. Swelling, tissue becomes swollen and tight. 3. Heat, the affected area feels warm to the touch. 4. Pain, tenderness or discomfort. 5. Fever and chillness in systemic cases. 6. Lymphadenopathy, swelling of the lymph nodes. Diagnosis. 1. Clinical evaluation based on appearance and symptoms. 2. Laboratory tests, blood tests to check for elevated white blood cells. 3. Cultures, wound cultures to identify the causative organism if pus is present. 4. Imaging, ultrasound or MRI if an abscess or deep infection is suspected. Nursing diagnosis. 1. Acute pain related to infection and inflammation. 2. Impaired skin integrity due to infection. 3. Risk for infection, spread or recurrence. 4. Knowledge deficit regarding condition, treatment and prevention. Management. 1. Assessment, regular monitoring of the affected area for changes. 2. Pain management, administration of analgesics. 3. Skin care, keeping the affected area clean and dry. 4. Education, teaching proper wound care and signs of complications. Treatment. 1. Antibiotics, oral or intravenous depending on severity. 2. Pain relief, NSAIDs or acetaminophen. 3. Wound care, proper cleaning and dressing of the affected area. 4. Hospitalization in severe cases requiring IV antibiotics. Psychosocial medicine. 1. Emotional support, addressing anxiety and fear related to infection. 2. Education, providing information about the disease, treatment plan and prevention. 3. Support groups, connecting with others who have experienced cellulitis. Prevention. Good hygiene, regular hand washing and skin care. 2. Wound care, proper treatment of cuts, scrapes and insect bites. 3. Managing chronic conditions, controlling diabetes and other risk factors. 4. Protective clothing, wearing gloves or long sleeves when at risk of injury. In conclusion, cellulitis is a common infection that requires timely diagnosis and treatment to prevent complications. Awareness of risk factors, signs and symptoms, along with proper management and preventive measures, can significantly reduce the incidence and impact of cellulitis. Thank you. Have a wonderful day.